Hello, welcome to Pointe Urgent Care video blog. I'm Dr. Siddiq. We started this video blog so that we can discuss some common medical conditions that arise in our daily lives. Today I would like to discuss about fever. Now, fever is a very common condition that and a very common symptom that occurs that we are faced with very frequently. When a child gets fever, sometimes we are at loss about what we should do next, and we sometimes rush to the hospital or the emergency room. But there are a few things that we need to do initially if a child gets a fever. Most fever that occurs in children are viral and they could be self-limiting. But if a temperature goes over 102 degree Fahrenheit, it is of great concern and we should try to treat it as soon as possible. If a child has a history of fever seizures, those children should be treated very aggressively, even if the temperature is around 100 degree Fahrenheit. They should also have a definite follow with their primary care physician as soon as possible. Now, when a child gets a fever, there are many options that we have. We can start the child with children's Tylenol, which is a very good drug that lowers temperature in most instances. And children's Tylenol can be given every 4 hours if needed, according to the weight-based dosing. Alternatively, you can give children's Motrin, but children's Motrin can be given every 6 hours weight-based as needed. Children's Tylenol and children's Motrin can also be given every 3 hours alternatively. So if you give children's Tylenol now, wait for 3 hours, give children's Motrin, wait for 3 hours, give children's Tylenol, and so on and so forth, till the temperature is under control. If the patient does not have temperature, you do not have to give the Tylenol or the Motrin. Now, if after giving the children's Tylenol and the Motrin and the child still continues to have fever, we need to figure out a couple of things. One is we have to make sure that the fever is not due to something serious. And of course, those patients should also be seen by their primary care physician. Sometimes patients can have infections that could prevent them from getting the temperature under control, and they might need other medications like antibiotics and stuff like that. But one thing that is very easy and can be done at home by any parent is cold sponge. I'm an emergency medicine physician, and most of the time, over the last many years, when patients come to the emergency room, they tell us that they took the child and dipped him in a bathtub or gave a cold shower. That, I believe, is not the best way to treat it, because one, when a child is sick or when you are sick as an adult, you don't want to take a shower or you don't want to take a bath. It's probably a very uncomfortable thing. Also, once you give the child a cold shower or a bath, it generates shivering, and that can actually increase the temperature. So what should we do alternatively? We should do cold sponge. And how do you do cold sponge? I have a little demonstration here. You get room temperature water in a little bowl. The water should not be very cold. And of course, the water should not be warm and hot either. It should be just room temperature water. It's very comfortable. You take a little towel like this. You dip the towel in the water, right? This is room temperature water. Squeeze the water out completely. Squeeze the water out completely, right? And then you take the cold rag and insert it under the armpit of the child and let it stay there. Then you take another towel, dip it again, wring the water out completely, and then put it on the other armpit, just like what you did, like here. Wait for a few minutes. Most of the time, the cold rag sucks the temperature out from the armpit area. And then when it becomes warm, take it back again, dip it again, squeeze it, and put it back again. If you continue to do this, you'll see that the temperature will start coming down, and the patient feels much more comfortable when they do this. It's not a good idea to put it on their chest, or you can put a rag on the forehead, which is not very uncomfortable. If you want, you can put a rag in the general area where it's very warm, or the creases of your inguinal folds where it's pretty warm. That is also a nice place for you to apply a cold rag. But you don't have to put it on your legs or feet or abdomen or chest. So the best area would be in the armpits, in the inguinal area, and probably the forehead. Once you do that, you repeat that, and then you can check the temperature after maybe about an hour. But during this time, you should also continue taking the Tylenol. Now, that's the best way to do a cold sponge. Word of caution is, again, if a child has other associated symptoms like lethargy, the child is not eating or drinking, vomiting or diarrhea, abdominal pain, shortness of breath, cough, headache, things like that, those children also should be seen by the primary care physician or at an urgent care as soon as possible, and the emergency room as soon as possible. I hope this video helps you. I hope to make further videos in the future. It's a little premature for me to do this. I'm not an expert in video, but I hope you enjoyed this. Thank you so much. Have a good day. Bye-bye.